The ReadyStand lift provides a safe and comfortable method of lifting semi-weight bearing patients. This patient must be able to comprehend and cooperate, sit on the side of the bed unsupported, and bear at least 30% of her body weight. Bed mechanics may be used to assist if needed. Place and secure a size-appropriate sling around the patient's waist. The sling should be positioned on the lower back. Ensure the tag is right side up and facing outward, away from the patient's skin. The tag will identify both sides of the sling and weight capacity. Before each use, check for frays, cuts, and tears in both the strap and body of the sling. If any damage is suspected, don't use and set the sling aside for further inspection. When fastening the sling, take the clasp. Click the buckle into place. Secure the belt by pulling the strap until it's snug around the patient's waist. The bed should be in the lowest position. Bring the ReadyStand device directly in front of the patient and ask her to place both feet on the footplate. The leg base may be adjusted for easy maneuvering by stepping on the ergonomic foot pedals. Before lifting the patient, be sure to lock the brakes. The shin cushion should be adjusted to accommodate varying patient heights in order to prevent direct pressure on the patella. Place the sling loops on the lift's metal receiving hooks. It's important to make sure the sling loops are attached at the same length or color on both sides of the lift. If the lift is not responding, check the red emergency stop button. It should be twisted and in the out position. Using the up arrow on the hand remote, lift the patient approximately 4 to 6 inches off the bed. Make sure the patient is secure and comfortable before continuing. Do not bring the patient to a complete standing position. It is important to keep a slight bend in the patient's knees. While lifted to a semi-upright position, maintaining that slight bend at the knee, the patient may be wheeled to the restroom, bedside commode, or chair. Before lowering, check that the patient is centered over the chair and placed as close as possible toward the rear of the seat. Once lowered, remove the sling from the receiving hooks. Using the hand grips, encourage the patient to get situated before moving the lift. With the patient secure and comfortable, remove the sling and keep it nearby for transferring back to the bed. If the remote control is not responding, the caregiver should push the yellow manual lowering button located beneath the battery pack. When returning to the bed, instruct the patient to maintain a seated position by pulling herself forward using the padded hand grips.